I'm very happy, Jonathan. I'm sure there are members of the community that haven't had a happy experience with Xanit, but I know a lot of people who have. So having Gibraltarians or enabling Gibraltarians to have a choice of medical clinics is, I think, really, really important. When my brother was very ill in Xanit and I lived with him there for 3 months, Mark constantly felt comforted, supported and cared for. And I honestly think that that's not something a lot of members of our community feel, and even the workers of the GHA feel. I don't think they feel comforted, supported or cared for.
Fair to say, I think that you're both a businesswoman, entrepreneur, and also a health activist. So I'm sure this makes good business sense, but what you're saying is that it also is important to supplement the public healthcare with different private options.
Absolutely. Look, Jonathan, if you do a lot of research on the rankings of healthcare systems in the world, many rank the UK below Spain and France and other countries, but even the one that ranks UK as the top now ranks the UK below France and Australia. Why? Because they use a mixture of private and public healthcare to provide the right system for local residents. So it's very clear that it works. Otherwise, those countries wouldn't be rising above the UK. And this is a ranking that, the UK often uses because it ranks at top. But there's a lot to be said about private and public healthcare.
And how easy or difficult has it been to set up Xanit in Gibraltar?
I cannot take the credit for setting it up physically. There's, the lawyers that acted for Xanit really worked very hard, but I can tell you that I know firsthand it was very, very difficult for them. And it was quite interesting because the same doctors that we send our people to see in Benalmadena want to come here and see our people, but yet they had to jump through hoops for 6 months. So not quite understanding that.
And what would you say to somebody who naturally is opposed to the privatization of healthcare?
No, don't get me wrong, I'm not calling for the privatization of healthcare. But if you're in a waiting list and you've got results and you're waiting to see your doctor, sometimes it may save your life if you go and get a second opinion. Had my brother done that after 5 visits to the accident and emergency where he was told he had a flu, he might still be alive today. And like him, I could name you at least 30 other people who ultimately didn't have the right care and passed away.
As a health campaigner, on the back of your brother's case, you've trying to extract improvements from the GHA. Have you got any updates for us?
Sadly, Jonathan, no. That interview, as I think you know, and a lot of people acknowledged in Gibraltar, was very, very hard for me. I bared my soul on local television. And it's interesting because since that interview, although I've reached out to the GHA and senior members of our community, I'm still to talk to someone or to receive an interview. In fact, I haven't met the latest prophets. And we do that a lot in Gibraltar, don't we? We bring people in, pay them a huge salary. They then rely on the people that were running the system to tell them what's wrong, and they don't really listen to the people who've suffered it. I talked to a lot of people in my activist group. None of them have been contacted to be able to explain what happened to them and their family members. I think if you have a racing car, for example, that breaks down all the time and even kills, you don't go and employ a really expensive new racing driver. You take the car apart, and if need be, perhaps you replace the mechanics. But you certainly don't keep doing the same things and expect different results.